Hi friends, good morning one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shevgaon. My subject is pharmacology and toxicology. We are going to study about a new unit like that is the name drugs acting on blood and blood forming organs. There are various drugs acting on the blood and blood forming organs. This unit are explained. This unit consists about various chapter like that drugs affecting coagulation of blood, fibrinolytic agents and antiplatelet drugs, then drug effective in iron deficiency anemia. जर आयर्न डेफिशियन्सी ॲनेमिया झाल्यावर कोणते ड्रग्स द्यायचं तो एक चॅप्टर. देन ड्रग्स इफेक्टिव्ह इन मेगॅलोब्लास्टिक ॲनेमिया. देन shock, blood substitutes and plasma expanders. These are chapter cover in blood forming organs unit. So one by one explain this chapter. The first chapter explain with you. We are going to explain drugs affecting coagulations of blood. Introductory part of this, what is the meaning of coagulation? What is the meaning of coagulation? Coagulation, these are the agents which promote the clotting or coagulation and they are used in hemorrhagic state. These coagulating drug or coagulation drugs, these coagulant drugs are used in the treatment of hemorrhagic state. Hemorrhagic means it's a hemorrhage is a serious bleeding inside a person's body. These are the condition is having bleeding inside in the body, so that condition called as hemorrhagic, and this hemorrhagic condition are a treatment by coagulating or coagulant agent. These are the agent which having promote the coagulation. But what is the meaning or what is the mechanism of clotting of the blood in the body? The mechanism of clotting involves the following sequence to that sequence for the reaction. So firstly, in body, thromboplastin is liberated due to damage of platelets and tissue. एखाद्या आपल्या बॉडीला जर जखम झाली किंवा इजा झाली तर त्यावेळेस काय होईल, त्या टिश्यू तिथल्या काय होतील, डॅमेज होतील. डॅमेज जर झालं तर त्यातून काय होईल, थ्रोम्बोप्लास्टिन नावाचं केमिकल लॅबरेट होईल. आणि थ्रोम्बोप्लास्टिन नावाचं केमिकल लॅबरेट झाल्यानंतर इन प्रेझेन्स ऑफ कॅल्शियम, त्यासोबत कॅल्शियमसोबत त्याची रिॲक्शन होऊन इट कन्वर्ट दी प्रोथ्रोम्बिन. त्यानुसार त्याचं काय कन्वर्जन होईल, प्रोथ्रोम्बिनमध्ये कन्वर्जन होईल. देन प्रोथ्रोम्बिन टू कन्वर्जन बाय थ्रोम्बिन अँड थ्रोम्बिन ॲक्टिव्हेट फायब्रिनोजेन अँड धिस थ्रोम्बिन ॲक्टिव्हेट दी फायब्रिनोजेन अँड फायब्रिनोजेन टू कन्वर्ट इज दी फायब्रिन अँड धिस फायब्रिन फॉर्म enmeshes red blood cells and other cellular elements and form a clotting. Then having clotting are the produce. This clotting are the produce or the mechanism of clotting of the blood. Then are firstly liberated the thromboplastin because of damage of the platelets and tissue. Then this thromboplastin, its presence of calcium, it convert to prothrombin, and this prothrombin is conversion to thrombin, and thrombin activates fibrinogen and to get convert fibrin, and this fibrin forms enmeshes red blood cells and other cellular elements and then forming a blood clot. This is the mechanism of blood clotting. The coagulation means promote the coagulation. These are the agent or coagulant. These coagulants means these are the agent which promote the coagulation and they are used in hemorrhagic states. Okay, then next slide, classification of coagulants. कोणकोणते coagulants आहेत ज्यामुळे coagulants increase होईल किंवा improve the coagulant होईल, म्हणजे जिथे आपल्याला ब्लड क्लॉट करायचं आहे अशा त्यासाठी काही ड्रग्स लागतील तर त्याचं क्लासिफिकेशन दिलेलं आहे. क्लासिफिकेशन ऑफ कॉग्युलंट्स. विटॅमिन के इज अ कॉग्युलंट ड्रग्स, सो दे आर हॅव्हिंग अ क्लॉटिंग एजंट विटॅमिन के. दिस विटॅमिन K1 from plant is synthesis, that's a name. For example, phytonadione, it's a K1, it's obtained from plant. Then K2 from bacteria, the example that is menaquinone is the K2 vitamin from bacteria. And last K3, these are the synthetic vitamins, for the example menadione. These are the coagulant agent that having produced the clotting of the blood in body. Then second class is that is other or miscellaneous class, that consists various examples like that fibrinogen, anti-hemophilic globulin, tissue extract, adrenochrome, routine, and various another example of these miscellaneous class. These are all of the example are the coagulant agents. These are the agents that having produce the or promote the coagulation and that having used to hemorrhageous condition. So one by one these drugs are explained. So first, vitamin K. Vitamin K, it's a fat soluble vitamin. It is not a single entity drugs. This vitamin K naturally it occurs in the form of two distinct substances. Naturally it occurs from two distinct substances from K1 and vitamins K1 and K2. But vitamin K3 is a lipid soluble and synthetic compound vitamins. These vitamin K का गरज आहे विटॅमिनची कॉग्युलेशनसाठी, तर विटॅमिन के इज नेसेसरी फॉर द बायोसिंथेसिस ऑफ प्रोथ्रोम्बिन मीन्स विटॅमिन factor number 2. Then factor number 7, that's name is a pro-converting factor. Then factor number 9, that's name Christmas factor. And last factor number X means start factor. These are the coagulant factors that having to biosynthesis for the necessary of vitamin K. Vitamin K is necessary for the body for the biosynthesis of prothrombin, then pro-converting, Christmas factor, and start factor. These are the coagulant factor and that having biosynthesis by using vitamin K. So these factors are important for the clotting of the bloods. Vitamin K is produced by bacterial flora of human intestine and it is absorbed in the presence of bile salts. This vitamin K is produced by bacterial flora of human intestine. This vitamin K are the produced from the human intestine and it is absorbed in the presence of bile salts. It also can be absorbed on a parenteral administration of this vitamin K. This is the vitamin K. Uses of vitamin K. These vitamin K are used for the various disease or various disorder like that hypoprothrombonemia. Hypoprothrombonemia means it is the rare blood disorder that having this disorder or disease consists the deficiency of factor 2, that's named prothrombin. This factor 2 deficiency of factor 2 coagulant factor, that's named prothrombin. This resulting in tendency to prolong bleeding. This disease occurring to that resulting that tendency to prolong bleeding of the blood from the body, and that condition called as hypoprothrombonemia means deficiency of prothrombin factor coagulant factor 2 that having resulting to tendency prolonged bleeding of the blood from the body due to hepatocellular disease, because these prothrombin are the biosynthesis in the liver, and so hepatocellular disease मुळे that having produced the hypoprothrombonemia. Obstructive jaundice and chronic diarrhea are also treatment by vitamin K. Then for treating a toxicity of oral anticoagulant and salicylates, these are vitamin K are used in the treatment of toxicity of oral anticoagulant. Oral anticoagulant, for example, coumarin derivatives or warfarin, that having a toxicity of these drugs to treatment of vitamin K for the toxicity of oral anticoagulants and salicylates drugs. Then next slide, fibrinogen. Fibrinogen, these are the obtained from human plasma. These are the coagulant agent. It's obtained from the human plasma, and this fibrinogen is used to control the bleeding to control the bleeding in hemophilia and also in the deficiency of anti-hemophilic globulin. These fibrinogen are used to control the bleeding in hemophilia and also in the deficiency of anti-hemophilic globulin. These anti-hemophilic globulin, these are also having a coagulant factor number 8, and these deficiency are treated by fibrinogen. These fibrinogen are used to control the bleeding in the body. These fibrinogen in externally that having administration by 0.5 gram as intravenous infusion. Then second, next slide, anti-hemophilic globulin. Anti-hemophilic globulin, it is also having highly effective in controlling the bleeding of the blood. It is prepared from the pool human plasma. These anti-hemophilic globulin are prepared from pool human plasma, and these anti-hemophilic globulin are the used in hemophilia and AHG, means anti-hemophilic globulin deficiency. Anti-hemophilic globulin means coagulant factor number 8. These are the treatment or controlling the bleeding. It is also prepared from pool human plasma, and these are used in hemophilia and AHG, means anti-hemophilic globulin deficiency. Then next slide, tissue extract. This tissue extract, it acts by activating a platelet aggregation, and that tissue extract, it can be used to control the internal hemorrhages. जे काही इंटरनल हेमोरेजेस आहेत त्यांना कंट्रोल करण्याचे काम ह्या टिश्यू एक्स्ट्रॅक्टचं आहेत. इट्स ॲक्टिंग बाय ॲक्टिवेटिंग द प्लेटलेट ॲग्रिगेशन. सो then internal hemorrhages can be controlled by tissue extract. Then adrenochrome, it reduces capillary fragility. It prevents the bleeding from raw surfaces and microvessels. जे काय बॉडीमध्ये मायक्रोव्हेसल्स असेल किंवा रॉ सर्फेसेस असेल त्यांची ब्लिडिंग स्टॉप करण्यासाठी these are the using adrenochrome. These are the oxidation of adrenaline or constriction of the blood vessels. This adrenochrome is the oxidation of adrenaline that produce the adrenochrome. It prevents the bleeding from raw surfaces and microvessels, for example epistaxis, hematuria and retinal hemorrhages. These drugs are used in the treatment of hematuria and retinal hemorrhages. Then next slide show routine. These are the plant glycosides, and these routine are used to reduce the capillary bleeding. These routine are the plant glycoside and used to reduce capillary bleeding, and this routine is used with vitamin C and which facilitates its action. These are the routine are the also having it's also having a coagulant agent. Then local hemostatics means typetics. These are the substances used to stop the bleeding from local sites. जे काय लोकल साईट आहे तिथलं जे काय ब्लिडिंग स्टॉप करायचं त्यासाठी जे काय सबस्टन्सेस यूज केले जातात दॅट्स कॉल्ड ॲज लोकल हेमोस्टॅटिक्स. These are effective on oozing surfaces like tooth sockets and open wounds. जे काय सर्फेसेस आहेत टूथ सॉकेट सारखे असेल किंवा ओपन ओन्स सारखे असतील त्यांना ट्रीटमेंट करण्यासाठी लोकल हेमोस्टॅटिक्सचे जे काही एजंट आहेत त्यांना यूज केलं जातं. दे शुड नेव्हर बी इंजेक्टेड. इट्स ऑल्सो हॅविंग नेव्हर बी इंजेक्टेड. सो one by one explain these local hemostatics agent. First is the thrombin. It is obtained from bovine plasma. It is applied on a bleeding surfaces as a dry powder or as a freshly prepared solution. हे जे काय थ्रोम्बिन आहे इट इज ऑब्टेन फ्रॉम बोव्हिन प्लाझ्मा आणि इट इज अप्लाइंग ऑन द ब्लिडिंग सर्फेसेस. जिथून रक्त बाहेर येत आहे दॅट इज कॉल्ड ब्लिडिंग. त्या ब्लिडिंग सर्फेसवरती काय करायचं आहे ड्राय पावडर अप्लाय करायची डायरेक्ट थ्रोम्बिनची किंवा फ्रेशली प्रिपेअर सोल्युशन. इट इज यूज इन अ स्किन ग्राफ्टिंग. So these are the thrombin are the used as a local hemostatics. Then second local hemostatics is fibrin. It is obtained from human plasma and it is used as a sheets or foam for covering a bleeding surfaces. Then gel form. This gel form, it's a spongy gelatin. It is a moisture with saline or thrombin solution and used for packing the wounds. This gel form, it's completely absorbed within 2 months and it can be left in place after suturing a wounds. These are gel form are the spongy gelatin in nature. It's a moisture with saline or thrombin solution and used for packing the wounds. म्हणजे जखम पॅक करण्यासाठी हा जेल फॉर्मचा यूज केला जातो by using with moisture with saline or thrombin solution. And it's completely absorbed within 2 months and it can be left in place after suturing a wounds. Then next, local hemostatics agent, the name that is Russell's viper venom. It enhances the coagulation by stimulating the thrombokinase agent. This Russell's viper venom, it's also having enhanced the coagulation process by stimulating the thrombokinase. And this thrombokinase, it is used to stop the external bleeding in hemophilics. It is used to stop the external bleeding in hemophilics. Then fifth number, vasoconstrictors. This also having a local hemostatics. Vasoconstrictors, cotton gauze soak in 1% adrenaline and can stop the epistaxis or similar bleeding. ब्लिडिंग आपला स्टॉप करायची त्यासाठी व्हॅसोकन्स्ट्रिक्टर पण आपण यूज केले जाऊ शकतात. त्यामध्ये कॉटन गॉज घ्यायचा आणि 1% ॲड्रेनालिनमध्ये त्याला सोक करायचं आहे. देन हॅविंग स्टॉप दी ब्लिडिंग. दिस ऑल अबाउट द coagulant agent are the local hemostatic agent or various classification of coagulants are described. Then new point, anticoagulant agent. Anticoagulants, these are the agent which inhibit the process of clotting. जे काय आत्तापर्यंत प्रोसेस बघितली त्याच्या पूर्ण उलटी चालणारी ही जी काय प्रोसेस आहे त्याला दॅट इज कॉल्ड ॲज अँटीकॉग्युलंट्स. म्हणजेच इनहिबिशन ऑफ द प्रोसेस ऑफ क्लॉटिंग. जी क्लॉटिंगची प्रोसेस जी आहे ती इनहिबिट केलं जातं त्या एजंटला म्हटलं जातं अँटीकॉग्युलंट्स एजंट. अँटीकॉग्युलंट्स एजंट्स आर द एजंट्स विच इनहिबिट द प्रोसेस ऑफ क्लॉटिंग. सो व्हेरियस classification of anticoagulant are the described. Classification of anticoagulant one by one explain. So first class in vitro anticoagulants. By using these are in vitro anticoagulants means the blood are stored in vitro condition or practically. So these anticoagulant are used. So storage of the blood in practical or blood donate that having timing, these anticoagulant are the use for the coagulation to prevent the coagulation of the blood in blood bank. So various example are the use like that citrates, oxalates, fluorides and EDTA, ethylene diamine tetraacetic acid. These are example of in vitro anticoagulants. In vitro means practically outside the body. म्हणजे जर ब्लड आउटसाईड द बॉडी केलं म्हणजेच काय ज्यावेळेस आपण ब्लड डोनेट करतो त्याच्या बॅगमध्ये असतं त्यावेळेस अँटीकॉग्युलंट असतात. त्यामध्ये कोणकोणतं असतात मग फॉर एक्झाम्पल सायट्रेट असू शकतं, ऑक्झॅलेट असू शकतं, फ्लुराइड्स किंवा EDTA, इथिलीन डायमाइन टेट्राॲसिटिक ॲसिड. दीज आर द अँटीकॉग्युलंट एजंट बाय युझिंग इन व्हिट्रो कंडिशन. देन इन व्हिवो अँटीकॉग्युलंट्स म्हणजे बॉडीच्या आतमध्ये. इन व्हिवो म्हणजे काय बॉडीच्या आतमध्ये जे काय कार्यरत आहे त्यांना म्हटलं जातं इन व्हिवो अँटीकॉग्युलंट्स. दीज आर ऑल्सो कॉल्ड ॲज ओरल अँटीकॉग्युलंट्स. फॉर एक्झाम्पल कोमॅरिन डेरिव्हेटिव्ज, इंडॅनेडायोन डेरिव्हेटिव्ज अँड वारफॅरिन. दीज आर द ड्रग आर यूज फॉर द स्टॉप द क्लॉटिंग or prevent the action of clotting in the blood. And then last class that is both in vitro and in vivo anticoagulant. हा असा एक्झाम्पल आहे की जे इन व्हिट्रोमध्ये पण यूज केलं जाऊ शकतं आणि इन व्हिवो म्हणजे प्रॅक्टिकली पण आणि बॉडीमध्येही यूज केलं जातं. त्याला म्हटलं जातं हेपॅरिन. इट इज ऑल्सो हॅविंग पॅरेंट्रल अँटीकॉग्युलंट. फॉर द एक्झाम्पल हेपॅरिन. दीज आर ऑल अबाउट द अँटीकॉग्युलंट्स. म्हणजे जर रक्ताची गाठ तयार होत असेल तर त्याला कमी करण्याचं किंवा ते कॉग्युलेशन कमी करण्याचं जे काही काम आहे ते हे एजंट करतात. म्हणजे दॅट इज कॉल्ड ॲज अँटीकॉग्युलंट एजंट. जर प्रॅक्टिकलमध्ये असेल, जर बॉडीच्या बाहेर ब्लड असेल तर त्यावेळेस त्या ज्या ब्लडचे जे काय कॉग्युलेशन होणार आहे ते स्टॉप करण्यासाठी जे काही एक्झाम्पल यूज केले जातात त्यांना म्हटलं जातं इन व्हिट्रो अँटीकॉग्युलंट. फॉर एक्झाम्पल सायट्रेट्स, ऑक्झॅलेट्स, फ्ल्युराइड्स अँड EDTA. आणि जे आहेत इन व्हिवो अँटीकॉग्युलंट म्हणजे ब्लडची जर एकत्रपणा येत असेल किंवा गाठ तयार होत असेल दॅट हॅविंग क्लॉटिंग ऑन द ब्लड in the body, so that having use of various drugs like that name coumarin derivative drugs, indane derivatives and warfarin, and then last drug heparin. These heparin drugs are used in both in vitro and in vivo as an anticoagulant. These are the classification of anticoagulant and one by one explained in next lecture. So thank you.